Dr. Fackrell. Welcome to the Health Corner. Today we're going to talk about the difference between upper respiratory tract infection and influenza. I get questions quite a bit as far as what the difference is and when you need to worry about it. This year has been particularly bad, this winter, for influenza. In fact, we've had at least 3 deaths in our little Idaho area with it this year so far. So it's something we definitely worry about. On the other hand, the upper respiratory tract infections are not that worrisome, and it's pretty common. And so we get a lot of people that come in wanting to know what the difference is and when we need to worry about. So Jessie is a PA who's worked with me in the past, and she's going to take a few minutes and talk about the difference and when we need to worry.
Hello, and welcome to Health Corner. My name is Jessie. I am a PA student, and today we will be talking about an upper respiratory infection, or more commonly known as the common cold, and we're going to be comparing it to the flu and how you can know the difference between the two. First of all, what causes the cold? Well, a virus is what causes the common cold, and the most common virus that causes a cold is rhinovirus. When is it more common to get a cold? Well, the peak months for cold season are in temperate climates, like here in Idaho we live in a temperate climate, is from September to March. Now if we were to live in the tropics, so a lot warmer than here in Idaho, it would be during the rainy season. Symptoms present themselves after the incubation period. The incubation period of the common cold, actually you don't have any symptoms. The incubation period can last as long from about 48 hours of exposure to 72 hours and can last as long as a week. Viral shedding is the next phase of the common cold, and this just means that you are contagious to other people. The most common times for viral shedding are about day 3 to day 5 of symptoms, but can last as long as even 2 to 3 weeks, some literature says. Viral shedding is also apparent when the symptoms are at their peak, and this just means that the symptoms are at their worst. How is the common cold spread? It's spread by a couple different ways. The first is air droplet transmission. This means that droplets come out of your mouth, maybe if you cough or you sneeze, and are spread in the air, and other people can breathe in those droplets and become infected with the flu or with the common cold. Another way is hand-to-hand contact. So maybe you shake someone's hand that just sneezed on their hand, and then you put your hand, maybe you eat with your hands, or you put your hand in your eye, and then you become infected with the cold. What will you feel like when you have a cold? Well, the signs and symptoms of a cold are common. I'm sure every one of you who are watching this have experienced a cold before. You'll have nasal symptoms, which are the first symptom. They've done studies and found that the first symptom that's present is nasal symptoms, and this could mean a runny nose, sneezing. It could also mean congestion where you can't breathe out of your own nose. Another symptom is sore throat, and this often feels scratchy and a little achy, like your nose is draining down the back of your throat and your throat is a little raw. Your eyes can be burning or watering, both eyes. You may have a cough. It is dry and non-productive. And non-productive just means that you're not coughing anything up. You just have a tickly, kind of raw, scratchy throat that you feel like you need to cough, but not cough any junk up. You may feel tired, weak, and in general just not feel like yourself. Maybe just not feel 100%. You may have muscle aches, a low-grade fever, and a low-grade fever means that it's below 101.4 degrees. Other signs that you may have from a cold, including the runny nose, is it may be clear in color. Your mucus in your nose, or your snot in your nose, may be clear in color or green. You may have a red throat. When you look down the back of your throat, you see that your throat is really red and maybe angry because it's sore. Are there complications from having a cold? Yes, per se. We call these secondary bacterial infections, and what that just means is you've had the cold for long enough that you've started to have another problem with it. It's not just the cold and then it ends, but it starts out as a virus and may become bacterial in nature. this can happen, and bacteria can actually cause sinusitis, which is just a fancy name for you have a sinus infection. Or you may have an ear infection. You may develop bacterial bronchitis, where you're coughing up junk and have that nasty cough that won't go away, and maybe you're having a hard time breathing with it too. It can also go on to develop something more serious known as pneumonia. In general, these secondary bacterial infections or complications of the cold usually develop at day 7 to 8, maybe even 6. And how will you know this? Because at day 6 or 7 of your symptoms, you're not feeling better, and you may be even feeling worse. What can you do to make yourself feel better? So you may think, oh, this is a virus. What can I do? Well, first misconception I think that people have is they'll come into the office and it will be 2 days. They've been feeling sick for 2 days. Well, as we talked about before, a cold is caused by a virus, not by a bacteria. And the first thing they'll ask me or request is, hey, I'm feeling sick, can I get an antibiotic? Well, if it's a virus causing it, an antibiotic is not going to help. Antibiotics are used to treat bacterial infections. And it's important to remember this because antibiotics are needed, especially when that secondary complication may happen. If I were to give you an antibiotic too soon and then you go on to develop a secondary infection such as a sinus infection or an ear infection or pneumonia, then there's a really good chance that that antibiotic will not work as it should. So this is something to keep in the back of your mind, that maybe you should wait it out a little bit, let the virus run its course, and do what you can before you actually do need an antibiotic. Then when you need it, it will be there and it will work like it's supposed to. What else can you do to make yourself feel better? Well, with the common cold, you're going to treat your symptoms. And that just means you're going to take things that helps your runny nose. If you have a runny nose or a congested nose, then it's good to take a decongestant such as Sudafed. If you have muscle aches or body aches or a fever, maybe ibuprofen or Tylenol or Motrin or Advil. Any of those will help you with both your fever and your muscle aches and your sore throat. As I mentioned, with your nasal symptoms, you can take a decongestant such as Sudafed. Another good decongestant would be phenylephrine. Another thing you can do, now those are tablets that you take and swallow. They're a pill that you swallow. But you can also go the nasal spray route. Nasal sprays are really good because they get right to the problem. Now, with Afrin, you need to be careful if you use this or similar nasal sprays with similar ingredients as Afrin, because you can go on to develop rebound congestion. And that just means your body has gotten used to the Afrin opening up your nasal passages. You can develop this if you use Afrin for longer than 4 days. The range is about 3 to 5, but I usually tell people 4. So what else can you do to make yourself feel better if you shouldn't be taking an antibiotic quite yet? Well, with the common cold, you're going to treat the symptoms. So if you have nasal congestion, you might want to take a decongestant such as Sudafed or phenylephrine. Sudafed has an ingredient called pseudoephedrine, and this can actually increase your heart rate and your blood pressure. So if you have hypertension or high blood pressure, you may want to not take Sudafed, just for your information. A good alternative for people who have high blood pressure problems is a medication by the name of coricidin. This is made special for people with high blood pressure. And you can go to your local pharmacy, and it's actually in the over-the-counter section. You don't need a prescription for these. And there should be some that maybe the pharmacist would recommend too. It's always a good idea to talk to your pharmacist when you have any questions about medications. They're really smart, they know what they're doing, and will be able to help you. Another good ingredient to remember is guaifenesin. This is a common ingredient found in Mucinex. And just like the commercial says about Mucinex, it really does thin the mucus out and helps your body get it out and get rid of that viral infection. The maximum dose is 1,200 milligrams twice a day. So that's something just to keep in mind and to look at when you're looking at those over-the-counter medications. To look for that, maybe if you're having really strong symptoms, you may need a little bit higher dose than what's on the box. Another thing to be careful of is antihistamines. Antihistamines with the common cold will actually dry your nose out and dry your secretions up and thicken them, which may make your cold last longer and may actually cause bacterial infections later on. So try to avoid an antihistamine when you have a cold. Antihistamines include Benadryl, which is a common one, maybe Claritin or Clarinex, and the list goes on of antihistamines. The label should be on the back of the box when you read it. If you have a cough, you'll want to decide how to treat this based on a couple of things. First, if you have a dry, tickly cough that you can't quite get to stop and is just annoying, you may want to look for medications that have dextromethorphan in it. The maximum dose of dextromethorphan is 60 milligrams twice a day. So when you're looking at those over-the-counter medications, again, look for this if you really have some severe symptoms. Dextromethorphan is a cough suppressant, so it will help you not cough anymore. If you have a cough that is thick, it feels like you have to get junk out of your lungs, you may want to have something that has, again, that guaifenesin in it because it will thin out the mucus and help you get rid of it. Something to be careful of and to watch for if you're having the common cold is if maybe you're having trouble breathing or you have a little wheezing going on. You may notice this in your child that has a cold. So you just want to watch for this. Signs of having trouble breathing that you can look for in little kids include accessory muscle usage, and that's just a fancy word for meaning these muscles in the neck of your child will be tense and they'll be trying to breathe, and you can tell these muscles are trying to lift the clavicle and lift the rib cage to expand those lungs. So look for that. Another thing to look for is belly breathing. You can lift up their shirt and actually watch their belly. If their belly is breathing and breathing quite fast, you may know, hey, my kid is not able to get air right now, I need to get him in. All of those are signs of needing to go see the doctor. There are things we can do here in the office and in the hospital in the ER to help your child breathe or help you breathe if you're having problems, such as nebulizer treatments, or maybe they'll prescribe you an inhaler if needed. So that's something to look for. Don't hesitate to go see a healthcare professional if you or your child or someone you know is having trouble breathing. Another thing that may help is humidifying the air. And make sure that you clean those humidifiers off though, and make sure they're really clean before you use them. There have been occasions when bacteria is spread because of old humidifiers that aren't cleaned right. So make sure you do that. Another option is neti pot or a nasal rinse. Again, with this you need to be really careful also that you're reading the directions and following the directions. Vitamin C actually can also help. There are studies that have shown that vitamin C helps sometimes and doesn't help in other times, but they also have concluded that more studies need to be done on whether vitamin C helps shorten the duration of colds. So that also may be something worth trying. It maybe will help you out. Another study was done on zinc. Zinc did prove to shorten the length and severity of symptoms of the common cold. About zinc lozenges, it's important to know that they work better when you take them right at the onset of your symptoms. So maybe the first day that you feel like you have a little more runny nose, or you notice that you've been sneezing a little more than normal, start taking that zinc and it will have a greater chance of decreasing the length of your cold and the severity of the symptoms of your cold. So what can you do to prevent the common cold? What can you do to help yourself not get it and your family not get it? Well, that's easy. The single most important way to prevent the common cold is to wash your hands. Remember, is that when you sneeze or you cough, it is important to cover your mouth, but I think an even better way to prevent the spread of the common cold is to cough or sneeze into your sleeve of your shirt, because the fibers of the fabric will catch the air droplets and it won't contaminate your hands. Next, we're going to switch gears and talk about the flu. And hopefully you can see the difference, and this video will help you see the differences between the two. There are slight differences that are maybe important to know and may help you out. The flu is highly contagious, which you know. Transmission of the flu, so you become infected with the flu the same way that you did with the cold. So airway droplets through the air or direct contact, either hand, hugging, kissing an individual, you can get the flu that way. The incubation period of the flu is very similar to the cold. The incubation period, which again is the period when you are infected with the virus, but you don't have any symptoms yet. This can be anywhere from 1 to 4 days. Typically, in a healthy individual, the flu will last anywhere from 1 to 7 days. But if an individual is not healthy, maybe you have some other problems going on, it can last a lot longer, and eventually complications can become of that. Signs and symptoms of the flu vary a little bit from the cold in that they come on really suddenly, whereas the cold may start out a little bit more gradually. So that's one thing that helps you differentiate the flu from the cold, is you have sudden, abrupt symptoms. Those symptoms include a fever, which your fever can last anywhere from 1 to 7 days. It more commonly will last for 3 to 5 days, however. You may feel really bad. You just don't feel like yourself. You're tired. You have muscle aches. Specifically, muscle aches are a very common symptom of the flu. You really have a lot of muscle aches, and commonly people will say that their low back is what aches the most. You may have a headache. You may have nasal congestion or a runny nose. You may have a non-productive cough, and again, that's just a cough where you're not coughing sputum or mucus up. It's just dry and more tickly in nature. You may have a sore throat. Your face may be flushed. Both eyes may be red. The whites of your eyes may be a little red. You may also have lymphadenopathy, which is a fancy word for saying that your lymph nodes are sore. Maybe behind your ears or right here or in the back of your head or along your throat. They may be swollen and sore. You may be able to feel them even. Another thing that may present that's not as common is you may have nausea, maybe a little diarrhea with the flu even. Elderly patients typically present a little bit different sometimes. They may not have a fever. They may have more dementia type symptoms. So how do you prevent yourself from getting the flu? Well, the single best way to prevent yourself from getting the flu is to get your yearly flu vaccination. It's important to get it early and to realize that it takes 2 weeks for it to begin, your body to develop those antibodies to the flu vaccination, so you can prevent yourself from getting sick. Second thing, it's important to know who can get the vaccination and who shouldn't get the vaccination. Those who are older than 6 months old can receive the flu vaccination, and it's important that they get it. If you have someone or a little baby younger than 6 months old in your home, it's important that you get the flu vaccination so you prevent them from getting sick. You see how this works. If you get the flu, you may be taking care of that baby and you may get them sick, which could be a scary thing in a baby that young. Who should not get the flu vaccination? Well, those who have an allergy to chicken eggs should not get the flu vaccination. Those who are acutely sick, so what that means, if you were to come in today and you have a little bit of a fever and you wanted to get the flu shot, I would say wait until those symptoms go away and then get your flu shot. Another reason for you not to get a flu shot is if you've had bad reactions to vaccinations in the past. There is another option than just a shot in the arm that they typically give with the flu vaccination, and that's the intranasal vaccination. They give it through the nose, obviously, hence the name intranasal. But this is a live vaccination, which means the virus is alive. You should not get this if you're pregnant, and you should not get this if you have a reactive airway disease, such as asthma or COPD. So when you come in to see your doctor, like Dr. Fackrell, or your PA, like me, how are they able to tell, or how are we able to tell that you have the flu other than just your symptoms? Well, you can get tested for this. We have tests that we actually go in and swab the inside of your nose or throat, and it can confirm that you have the flu. I mentioned earlier that it's really important for you to get the flu vaccination if you are at risk to develop complications of the flu. And right now I'd like to discuss what complications of the flu means, or what typically those complications are. They may be a sinus infection, an ear infection, or pneumonia, or bacterial bronchitis, where you have that nasty cough for a long time, maybe not be able to breathe also. So who is at higher risk for complications of the flu? Well, the list of this is kind of vast and a little bit complicated, so I'm going to tell you a few of the most common. If you have any questions, please see your PA or your doctor, and they'll be able to go through these in more detail with you. But some of the most common ones to remember for those that are at high risk for developing complications from the flu include children under the age of 5 years old, pregnant women, elderly people, also those with reactive airway diseases such as asthma or COPD. So what do you do if you have the flu? How can you be treated? Well, just like the common cold, you're going to treat the symptoms using those nasal decongestants I mentioned earlier, or the ingredients that will help your cough not be so bad. All of those things are really helpful with the flu, along with the humidifiers and the nasal sprays, and the vitamin C and even the zinc can be helpful. Another really important thing to remember is you need rest when you have the flu. It's important for your body to rest and get the sleep it needs to help heal and get rid of that darn flu virus. Another important thing to remember is you need to increase your fluid intake. Now, I didn't mention this before with the common cold section, but it's also important to drink fluids and to hydrate yourself properly when you have a cold too. 64 ounces is recommended for an adult to drink of just water every day. Remember, 8 ounces is 1 cup of water. Antivirals can also be used. These are used in patients that have come in to see a doctor or a PA, and they have a diagnosed case of influenza. And also, they need to be a person who is at higher risk for secondary complications to get to start on these antiviral medications. They're also important to start, it's also important to start these medications within 48 hours of symptom onset in order for them to work. And they have proven in the studies and in the literature that they will shorten the duration of the cold and help prevent or reduce the occurrence of secondary bacterial complications from the flu. Again, do you need to use antibiotics? Well, we want to save these for those bacterial complications that may come on later. Remember, rest, fluids, and treat those symptoms the best that you can. And if you have any questions come up in your mind or you're concerned about anything, remember, see your doctor or your PA, and they will be able to help you out.